Okay, I'm here to talk to you a little bit. I'm going to expand on some things Dr. Ginn and Larry said earlier today. I think a couple things that are really important to emphasize, and it doesn't matter whether you have an insurance practice or you have a private pay practice, you have 30 days to get the patient to feel that they're getting better. By the end of 30 days, you start having patients begin to kind of wonder why they're coming back. You have 3 months to actually have that patient realize that they're making functional improvement. By the end of 3 months, if you don't have that, 50% or more of the patients will stop coming back. So you have 30 days for them to start to feel better. You have 3 months for them to start to actually have new activities of daily living. That's what a functional improvement is, the ability to do something functionally. You have 6 months for them to get good enough that their family thinks, wow, and now their family wants to come to you. That's been my experience in my practice. So how do you do that? As I listen to everybody talk about why they're here, a lot of you are here because you've got environmental toxicities, industrial exposures, cardiovascular disease you're trying to treat, cognitive losses, and people kind of nearing retirement age that are kind of moving up to retirement. A lot of these things, of course, are actually vascular problems. When you have an industrial injury, you get a vasculitis. When you have mercury or heavy metal exposure, you get a vasculitis among the other injuries that occur. When you have a stroke or cardiac disease, obviously you're having a vascular injury too. So what I got interested in a couple of years ago, I didn't get interested in it. I had a big practice of personal injury, traumatic brain injury cases. I did neurosurgery for 5 or 6 years, developed chemical allergies, and went into neurology. And in neurology, I used neurosurgical techniques of monitoring the operating room to apply them in the outpatient setting. And the idea basically was that in the operating room in neurosurgery, you're using evoked potentials or computerized EEGs or brain maps or transcranial Dopplers, which let you look at blood flow in the brain. You're using them as a tool to tell you when you're about to do something wrong. They usually go bad with enough time to reverse whatever you're doing in order to try something different in the operating room or in the intensive care unit. Well, I took those techniques, since I was trained in that, and moved them into the outpatient setting. I wasn't using them to tell me if I'm doing something wrong, but instead I was using the converse to see if I tried out a new medicine on somebody, if they would get better, if the test would get better. You know, the idea basically is that when you're dealing with the nervous system, when you do something wrong, you usually know it right away. But when you're doing something right to help the nervous system heal, you don't really know it for a while because there's a repair process that goes on. So I was using the testing to try to identify what techniques to use to get the people better. And we had great results. I mean, they were spectacular results. Like one day, we had some patients walk through the door where I was treating bad migraine headaches in 2 patient populations. One was the traumatic brain injury, and the other one was women with breast implants that had ruptured and had caused vasculitis. Although at that time we didn't know the neurological problem was the vasculitis. And I was monitoring them with different techniques. I was monitoring them with transcranial Doppler, brainstem evoked responses, computerized EEGs, evoked potentials, standard come out for migraines. Now, most of these people were on disability for 7 to 15 years, social security disability, and were refractory to everything, and were on narcotics. So I started looking at trying them out on just Toradol, which had just come out as an IV injection. I had tried them on, of course, Imitrex that came out at the exact same time, and a couple other medicines. And I had them all hooked up. I didn't expect any of the medicines to help these people. I expected that maybe some of the medications would help some people's tests get better. And then I would put a cocktail together of these medicines, and the people would get better, hopefully, maybe. They were on Social Security, after all. Well, what happened was a little bit surprising. What was really surprising. What happened was we gave Toradol to a bunch of people, and their blood vessels in their brain changed. They became larger, which nobody had ever identified could be done at that time. They dilated. When that happened, we had patients who were literally partially paralyzed in many cases from their brain injuries or from their vasculitis from the breast implants. Suddenly get up and walk across the room. You had people paralyzed who got up and walked across the room. Okay, we had people paralyzed who got up and walked across the room. I'm going to show you some videos in a few more minutes. We started then looking at every medicine out there that had a vascular effect or had a migraine effect and looked at the clinical effects. Every case, every office visit was monitored and audited by Medicare for 5 years. We had 100% auditing. After 2,500 cases, they identified that only one patient didn't get better and none got worse. These are people with plateaued brain injuries, from stroke, whatever. Also, their migraines got better, and that kind of brought us to a kind of a different approach towards migraines, which works in a lot of people who are refractory, and I'll talk about that in a second. The same thing happened with major improvements with the vasculitis patients from these breast implants. And at that time, there were 3 laboratories, neurological laboratories in the state of Florida who were authorized by the federal government to oversee the neurological evaluations of these women for the class action suits. Mine was one, there's another one in Tampa, and then there was one, I think, in Jacksonville. We had thousands of women come through the office. Virtually all of them had a chemical vasculitis in addition to their other problems. The cognitive losses that these people had, the balance problems, the bizarre behavior as far as they tend to be very, very irritable. They misinterpret people. They would have very poor short-term memory. Those cases, by the way, look just like a traumatic brain injury case if you run them through neuropsychological testing or brain mapping or anything else. But in those women's cases, the problem was the vasculitis. In the brain injury patients' cases, it was a problem of a direct injury to neurological control of the blood vessels in the brain mediated through the spinal column. Fortunately, both responded pretty well to treatments, which are using vasodilators. Shortly after that, neuropsychologists in the area started referring in patients with similar neuropsychological disorders on testing as the traumatic brain injury and the vasculitis women. And those were specifically autism, attention deficit disorder, and Asperger's syndromes. We looked for the vascular problem and found it. And at that time, the best tool and the only tool to look for it was this ultrasound. Now the better tools are PET scans and SPECT scans, and I'm going to run you through the testing very quickly so that you can look at these patients and you can understand how to use the test in your practice. Those patients got better too. We had, in some cases, up to 50 IQ point improvements in the first 30 days of treatment, which were stable. Generally, it's about 15 IQ point improvements. Then we moved on, and patients started referring stroke patients, and that's when Medicare really got involved, auditing us, as well as the state of Florida. And I'm going to show you the results of that, but essentially, you can get patients with neurological and vascular diseases better fast. The results I'm going to show you deal with using standard FDA medications that you're all comfortable with, ACE inhibitors, nitrates, calcium channel blockers. But I got to tell you that the studies that I have here were very unusual studies. They were developed to meet a specific need. I had to prove to the state of Florida and to other oversight groups that you could get patients with vascular disease better fast. That wasn't fraud, it wasn't quackery. So we took about 300 consecutive patients, 250 consecutive patients with stroke and brain injuries, mainly stroke, and in 3 weeks' time did outside testing, neuropsychological testing, neurofunctional testing, physical therapy activity testing, repeated the same testing 3 weeks later, and I'm going to go over the results in a few minutes. Prior to using standard medicines in these patients, I've used about 20,000 or more IVs in patients. These particular patients in these studies did not have IVs in them. They only had daily visits with me with medication adjustment, with monitoring of medications for 3 weeks. But prior to that, I've used about 20,000 IVs, and the principles I'm going to talk about with respect to the medicines, doesn't matter whether you're talking about IV medicines or you're talking about oral medicines or you're talking about IM medicines. Toradol as an IM drug is a very effective vasodilator. Doesn't matter what we talk about, they all have the exact same principles, the same approaches, the same side effects, of which those side effects can be serious and can be vascular. Basically, what I'm going to talk about today is kind of give you a quick overview of the neurology, because none of you are neurologists, but you're all treating neurological diseases. And you're going to get your patients better, and you're going to see that the patients are going to want to come back to you because they're getting better from their neurological problems. And you can use the nervous system as a way of monitoring treatment. You know, if something's going wrong in the nervous system, you'll know it right away. Dr. Ginn was talking about earlier that if you infuse vitamin C too quickly or in a hypertonic solution, or you infuse magnesium too quickly,